This is the Coronavirus Daily Briefing for Tuesday, March 24th, 2020. I'm Brian McCullough. More than 100 people died from COVID-19 in a single 24-hour period in the U.S. for the first time. New York sees the majority of its COVID cases under the age of 50. The debate about ending social distancing soon. Another big myth-busting thread. A new tool to protect healthcare workers. And a profile of Doctor Anthony Fauci. More than 43,000 coronavirus cases have been confirmed in the U.S. at the time of this recording, though experts say the true number is much higher. Yesterday saw the first day where more than 100 people died in the U.S. in a single 24-hour period. The focus continues to be on New York City and New York State, where the governor is requiring hospitals to increase capacity by at least 50%. New York State saw a one-day increase of nearly 5,000 cases, bringing the total to 21,689 cases in the state as of Monday night. And I want to continue to make note of two things from the New York and New York City numbers. New York State has now done 78,000 tests. The state is approaching the per capita testing numbers of the entire country of Korea. And the demographics in New York continue to be concerning. 58% of confirmed cases in the state are under the age of 50. 46% of cases in the state are aged 18 to 44. In Spain, Spanish soldiers found residents of nursing homes abandoned in several different locations. Quoting the New York Times, Margarita Robles, Spain's defense minister, quote, said that emergency military units dispatched to disinfect nursing homes had found there were some residents, quote, absolutely abandoned, if not dead in their beds, end quote. The defense ministry said that dead bodies had been found in multiple nursing homes that had discharged large numbers of employees in the wake of the outbreaks, but did not provide further details. The government will be, quote, forceful in its response to those who abandon older people, Ms. Robles said, end quote. Completing that country's about face, Prime Minister Boris Johnson announced last night that Britain is going into a virtual lockdown, closing all non-essential shops and banning meetings of more than 2 people. Britons are required now to stay in their homes, except for trips for food or medicine. This morning, it was announced that the Olympics will be postponed until at least 2021. In California, Governor Newsom has estimated that that state is short of hospital beds by around 17,000. In Arizona, a couple in their 60s watched President Trump and others tout chloroquine as a potential drug to combat the virus on TV, noticed that they had a bottle of chemicals that they used to clean their koi ponds sitting in their pantry that said it had chloroquine in it, and consumed a tablespoon amount of the substance. Quote, I saw it sitting on the back shelf and thought, hey, isn't that the stuff they're talking about on TV? The wife, who was not named, told NBC, quote, we were afraid of getting sick, end quote. The husband is now dead and the wife is still in the hospital. On Monday, the governors of Oregon, Michigan, Indiana, Wisconsin, and New Mexico ordered residents there to remain at home, while the governors of Massachusetts, Kentucky, and Maryland ordered all non-essential businesses closed. There is a new tool at covidactnow.org where you can enter your state to see charts estimating how many days your state might have to enact social distancing and other measures to prevent hospital overload. Again, that's covidactnow.org. There's also covidlocal.org, which has collected a set of guidelines for local leaders to follow in their communities. They call it a frontline guide for local decision makers. Again, that is covidlocal.org. And finally, a few more signs that there is a game plan to follow, that there is a light at the end of the tunnel that might allow us to return to life as normal at some point. In Wuhan, China, where the virus began, public transit is slated to start up again in the next 24 hours. And in Lombardy, Italy, the number of patients hospitalized for COVID-19 has actually fallen from 9,439 people to 9,266 people. Quote, we can say that today is the first positive day, said Giuliano Galera, Lombardy's leading health official. Quote, it's not the moment to sing victory, but we finally see the light at the end of the tunnel, end quote. Lombardy only went into lockdown March 8th, so it's not even been a month of lockdown there yet. A month is a long time, but it's also a manageable period of time, especially if results can be seen. Also worth noting that the world has officially surpassed 100,000 recovered cases worldwide. These are people who have been confirmed to have contracted the disease and have now fully recovered. As you've no doubt heard by now, last night President Trump seemed to endorse ending social distancing and other measures soon. In a long Twitter thread, Tom Inglesby, the director of the Center for Health Security at Johns Hopkins Bloomberg School of Public Health, said the United States is nowhere near where it needs to be to most effectively combat the coronavirus. Quote, anyone advising the end of social distancing now needs to fully understand what the country will look like if we do that, he wrote. Quote, COVID would spread widely, rapidly, terribly, could kill potentially millions in the year ahead with huge social and economic impacts across the country. These big social distancing measures take time to work, he wrote. The impact of big interventions in Wuhan, China took about 3 weeks to start to reverse things. Then every day the situation got better, end quote. I won't weigh in on the political back and forth of all of this, as this show continues to be apolitical. But I would echo the following point that others have made. It's understandable that some folks, most of us, are concerned about the economy and want to get society back to normal as soon as possible. But what some people are seeming to forget is that taking distancing measures now is designed to prevent a larger economic collapse, not to mention horrific costs to human life. Even putting aside the ethical issues for the moment, let me say this again. What do you think the economy would look like if there are no more doctors and nurses because they're all sick? If the entire medical system in the country collapses? And hey, what would happen to the economy if suddenly hundreds of thousands of people died? That would create an economic outcome orders of magnitude worse than anything we're seeing now. In other words, we're doing this now so that things don't get worse than they are. Scott Gottlieb, the former commissioner of the FDA, tweeted, there's a strong and understandable desire to return to better times and a functioning economy, but it should not be lost on anyone that there's no such thing as a functioning economy and a society so long as COVID-19 continues to spread uncontrolled in our biggest cities, end quote. Steve Vladek, a law professor at the University of Texas, tweeted, quote, prematurely relaxing suppression measures will dramatically steepen the infection curve, overwhelm hospitals, and have the same, if not worse, impact on the economy. When a substantial percentage age of the workforce is too sick or too scared to work, to say nothing of all the extra deaths, end quote. Leah Greenberg, co-executive director of Indivisible Guide, a legislative watchdog, tweeted, quote, I can't believe we have to clarify this, but a scenario where the hospital system collapses and 1 million Americans die is also a scenario where the economy is very, very bad, end quote. And writer and activist Wendy Thurm makes a point that I'm wondering about myself. Even if the federal government relaxes lockdown rules, that doesn't mean individual states will or will want to. Quote, how is the U.S. economy going to function without California, New York, Illinois, New Jersey, Pennsylvania, Washington, Massachusetts, Virginia, end quote. So what is the point of relaxing rules in some places but not others? The economy will still be mostly locked down, and all that might happen is that places where rules are relaxed will simply see their caseloads skyrocket and overwhelm capacity there. For those asking online this morning, it does appear that the federal government cannot overrule restriction measures in individual states or municipalities. Quoting the law professor Steve Vladek again, quote, Congress could arguably override them as applied to interstate commerce, but that ain't happening anytime soon. The argument is there, but courts have historically taken a fairly broad view of state public health regulations, even when they burden commerce, end quote. Speaking of the Olympics and the recent postponement of them, another quick account today from someone who caught the disease, who is young, healthy, and yet still struggling to overcome, quoting Newsweek. Cameron Vanderberg, who is from South Africa, sent out a series of tweets Sunday that follow his health on the 14th day of his battle with the virus that has been labeled a global pandemic. He gave his thoughts on how it affects not only a finely tuned athlete, but how it could affect fellow athletes training for the 2020 Summer Olympics, which were scheduled to begin July 24th in Tokyo. Quote, "I have been struggling with COVID-19 for 14 days today. By far the worst virus I have ever endured, despite being a healthy individual with strong lungs, no smoking, daily sports activities, living a healthy lifestyle, and being young, least at-risk demographic," he tweeted. "Although the most severe symptoms, extreme fever, have eased, I am still struggling with serious fatigue and a residual cough that I can't shake. Any physical activity like walking leaves me exhausted for hours," end quote. And he's an Olympian. Cameron Vanderberg, 31, won the gold medal in the 100-meter breaststroke at the 2012 London Olympics when he swam it in 58.46 seconds. He followed that up with a silver medal finish at the 2016 Rio de Janeiro Games. He retired in December 2018 after winning gold in the World Short Course Championships in Hangzhou, China. Though it's been just 15 months since his retirement, he considers himself still to be in good shape. But even this elite athlete has had difficulty dealing with coronavirus, end quote. And now, once again, a myth-busting roundup from the same source we quoted from last time, Fahim Younis, Chief Quality Officer and Chief of Infectious Diseases at the University of Maryland. Going to quote from this tweet thread almost in its entirety as a public service. Number 1, avoid shipped packages or gas station pumps or shopping carts or ATMs or you'll die. Wrong. Coronavirus surface survival is one thing. That surface causing an infection is another. Wash your hands. Live your life. Number 2, you can catch COVID-19 from ordering takeout food or Chinese food or the packaging of food. Wrong. COVID-19 is a droplet-related infection like the flu, not a foodborne infection like salmonella. There is no documented COVID risk with takeout food. Number 3, going into a sauna for 20 minutes can kill more than 90% of viruses, including coronavirus. Wrong. There are no scientific trials to suggest the validity of this claim. On the contrary, saunas can cause pneumonias, among other things. Next, if you lose your sense of smell, you have COVID. False. It is common to temporarily lose one's sense of smell with many viral infections or allergies. It's a nonspecific symptom that may or may not happen with COVID. So let me interrupt here and say that that's an important clarification to our story yesterday about you losing your sense of taste or smell and that being a sign of coming down with COVID-19. Losing your senses by itself do not mean you have COVID-19. As your run-of-the-mill seasonal allergies might cause that as well. But it could be a symptom, especially in conjunction with other symptoms, like the dry cough, fever, and headaches we've all been hearing about. The jury is still very much out, but the emerging consensus seems to be that the loss of senses could be another secondary symptom of COVID-19. Nonetheless, to clarify, losing your taste or smell does not guarantee you've caught COVID. Moving on with the myth list. Taking hydroxychloroquine and azithromycin preemptively is a good idea to prevent COVID. Wrong. These experimental drugs for coronavirus should only be used in select COVID patients. They can sometimes cause fatal heart rhythm problems, plus other side effects. Next, I received messages that using garlic/lemon with hot water or onions in the room will prevent or cure COVID-19. Is it true? No, that's just made up stuff. None of these substances have been scientifically tested against COVID. Don't share such posts. They create confusion. Next, our governor has declared a state of emergency. That must mean we're all going to die. Wrong. The state of emergency is more of a legal than a medical standard. It allows governments to access more resources like federal funds and personnel like National Guards. Next, always change your clothes/shower after coming home, or you will bring coronavirus to your family. Wrong. Cleanliness is a virtue. Paranoia isn't. Let's not scare people. Our biggest return on investment is hand washing, staying 6 feet away from others, avoiding large crowds, etc. End quote. Stamps.com brings all of the services of the U.S. Postal Service right to your computer in the safety and comfort of your own home, office, or anywhere else you're hunkering down right now. I've been telling you about how this allows you to stay inside and avoid crowds like we all should be doing right now, and I've told you how this will help small businesses continue to function even while working remotely. But did you know Stamps.com also saves you money with discounts you can't get at the post office? You get 5 cents off of every first-class stamp, for example, and up to 40% off USPS shipping rates with Stamps.com. And now, in addition to offering discounted U.S. Postal Service rates, Stamps.com also offers UPS services with discount rates up to 62%. Plus, with Stamps.com, you won't even have to pay UPS residential surcharges. Stamps.com is a no-brainer, especially now, saving you time and money and keeping you safe in these crazy times. Right now, listeners to this show get a special offer that includes a 4-week trial plus free postage and a digital scale without any long-term commitment. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com, enter briefing, BRIEFING. Stay safe, everyone. More than 2,000 emergency workers will begin wearing an internet-connected smart ring that takes continuous temperature measurements as a part of a study to see whether the device gathers data that can predict when people will get sick from coronavirus even before they present symptoms. Doctors and nurses at 2 San Francisco area hospitals will wear the ORA Ring, OURA, a lightweight titanium ring that is available to the public for $299 during the study. The ring will measure temperature, heart rate, and respiratory rate continuously. An increase in temperature could predict the onset of COVID-19, buying time for that person to isolate themselves and take other precautions to avoid potentially infecting others on the front line. Ashley Mason, a psychologist at UC San Francisco who is running the study, told KQED, "If this tells us things about symptoms that we're going to get before we get them, then we've got time to get ready and help ourselves be safe and help the people around us be safe," end quote. Quoting from KQED, Mason began recruiting her coworkers at UC San Francisco, and in the coming weeks, more than 2,000 doctors, nurses, and emergency responders will be wearing the ring, including ER Dr. Robert Rodriguez. He says the continuous temperature readings are ideal because fevers actually wax and wane. Quote, "That's far superior than just isolated checks because you can miss a fever if you're only checking it once or twice a day," he said, as doctors are currently told to monitor their health. Plus, the additional data the device gathers is even more valuable. Quote, "Elevated heart rate and elevated respiratory rate are even better predictors of disease than temperature," he said, end quote. People who already have the Oura Ring can also opt into the study, which will take months to complete using the Aura app. Over the last few weeks, a lot of people have been turning to Doctor Anthony Fauci for some leadership and direction around this crisis. Since most of our exposure to Dr. Fauci is in the background of and making quick announcements during White House press conferences, here are some extended thoughts from the man himself, excerpted from the interviews published recently in The Atlantic and Science magazine. In ensuring people that he's not being pressured by the White House to deliver a particular message, Fauci told The Atlantic, quote, "I made up my mind a long time ago, and this goes back to the first time I had to speak the truth to Ronald Reagan about the seriousness of HIV/AIDS, when people were not paying attention to it. I was like, the lone wolf out there. This is going to be big. We've got to do something about it. I'm going to do the same thing now. And my attitude is I'm going to keep doing that. I don't think they're going to try to silence me. I think that would be foolish on their part, and I don't even think they want to. I think in some respects, they welcome my voice out there telling the truth. I'm going to keep doing it, and no matter what happens to me, I'm going to keep doing it," end quote. Fauci also adds regarding President Trump, quote, "The thing that encourages me is that every time I've asked him to do something, cut out China travel or go to the mitigation guidelines, he's always ultimately listened to what I've said. When I've said, I really think we should do this, he's never said no and overruled my recommendation. No matter what his style is when it comes to the core of what gets done, thankfully he has listened to me," end quote. Overall, Fauci talks about balance in how we respond to the crisis, balance in social distancing guidelines when you're an essential government worker, balance in how to push back against an administration that often directly contradicts Fauci's own statements. Quote, "You do what you can do. as best you can, he tells Science Magazine. He also explains that we can't know what went wrong with our pandemic preparedness just yet, and that now isn't the time to stop and reflect. Quote, I think we'll have to wait until it is over and we look back before we can answer that. It's almost like the fog of war. After the war is over, you then look back and say, wow, this plan, as great as it was, didn't quite work once they started throwing hand grenades at us, end quote. It really is similar to that. Obviously, testing for the new coronavirus is one clear issue that needs to be relooked at. Why were we not able to mobilize on a broader scale? But I don't think we can do that right now. I think it's premature. We really need to look forward, end quote. And for anyone worried about Dr. Fauci falling ill and unable to continue being the voice of reason that many find comfort from, he says he's taking care of himself. Quoting from The Atlantic, there are risks that some people need to take because when it comes to the public health and the safety of the American people, sometimes you really have got to take some risks for yourself. Not everybody can shelter in place, but I try to do my best. I wash my hands 100 times a day. I don't ever shake hands with anybody. And when I'm talking to somebody, I try to stay 6 feet away from them. So I am doing that. When I am not here at work, I'm going about 20 hours a day. I try to do my best, end quote. That's all for today. This show is produced, as always, by Ride Home Media, written by myself, James Welsh, and Jackson Bird, edited by James Welsh and Jackson Bird. Be well, everybody. Talk to you tomorrow.